Hello, welcome to this video, which is video 2 in my knee replacement series. So in the first video I talked about arthritis and why you might need a knee replacement. In this video I'm going to talk about the kinds of exercises you could do prior to going for surgery, or if you are suffering from arthritis, to prevent yourself from needing knee replacement surgery. Now, exercise when you've got arthritis can be uncomfortable and painful. However, it's very important that you do that exercise. If you were to stop exercising because of the pain, you would fairly quickly start to see a deterioration in your condition. And the reason for that is that if you do not exercise, the muscles, ligaments, tendons and soft tissue around the joint will get progressively weaker and weaker and weaker. The weaker those structures are, the more pressure there will be on the surface of the joint, on the bone-to-bone contact where the inflammation is. So although it is uncomfortable to exercise when you suffer from arthritis, it's very important that you do it. Now, there is a balance to be had. I'm not saying that you should go off and do a marathon, because then you would cause way too much inflammation, but having a nice gentle exercise series that you can follow, which I'm going to show you in a moment, is very important at maintaining muscle strength, flexibility and balance around the joint. So I'm going to go through my exercise sheet. This exercise sheet, which has got 3 pages to it, is on the website. There's a link below this video where you can download these exercises, and I'm just going to go through them now so that you're clear on what to do. So the first exercise is what we call static quad contraction. So you sit on a bed or on the floor, put a pillow between your knees, just put this down, and you tighten your thigh muscles as tight as you can, pushing the back of the knee down into the bed, and then you pull your knees together against the pillow, like so, and then relax. So you tighten, push the back of the knee down, and then pull together. And what this is doing is it's strengthening this muscle here, vastus medialis oblique. This muscle here is very important in stabilizing your knee joint. So we're zeroing in on that muscle, trying to really get that muscle to work. The next exercise is what we call inner range quads. So we put a pillow underneath the knee, so the knee is slightly bent, about a 30 to 40 degree bend, and then we just tighten the thigh muscles, lifting the leg up. You can rotate the knee out slightly, just to get this muscle here working a little bit harder. So you're tightening the thigh, lifting the foot up, locking the knee out and down, like so. Okay. You also need to strengthen your hip muscles. So, to strengthen your hip muscles, and the reason we strengthen our hip muscles is because if you've got good hip strength, that's going to help to offload the knee. So to strengthen your hip abductors, you lie on your side, bottom leg bent, top leg straight, keep your hip forwards, and then you just lift the leg up to the side and down, up as high as you can get it and back down. That's going to strengthen your hip abductors. Then you can bend the knee, so you've got both legs bent, you keep your feet together and you lift the top knee up and back down, and that's going to get your glutes working, piriformis muscle working, and you just lift up as far as you can and back down, like so. Then we've got straight leg raise. So again, tightening your thigh muscles up. So you push the back of the knee down into the bed and you lift the leg up straight, up as far as you can and down. Up and down like so. And you're doing approximately 5 to 10 of each exercise. In order to bend the knee, what we do is we sit in a chair, sit at the edge of the chair, and you just slide the leg back as far as you can get it, bending the knee as far as you can, and then lifting the leg up straight. So you're bending back and then straightening. And really trying to bend back, stretching the knee out as far as you can get it, and then lifting up straight, getting these thigh muscles working. Hamstrings are the muscles at the back of the leg here, very important as well. I'm just going to show you now how you work your hamstrings. So just standing up next to the wall, balancing up against the wall, hands on the wall, nice and upright, and you're just going to bend the leg up as far as you can get it and back down. And what that will be doing is working the muscles at the back of the leg here, working your hamstrings. Next exercise are squats, but you can do what's called a supported squat by leaning against a door or a wall. So you put your feet in front of you, keep your feet facing forwards, about hip width apart, and you just slide down like so, 90-degree bend at the knee and back up. By leaning against the door is going to take some of my body weight so that it's not all going through my knees. Down and back up. Okay. If you're able and you're strong enough, and you can do it without too much pain in the knees, you can do it without leaning against a wall. Come away from the wall, slide down and back up. Keep your feet flat to the floor and stick your bottom back. Keep your shoulders up, like so. Poor technique, which you often see, people, they come forwards, lift their heels off the floor, and they squat like so. Or the other thing I often see is people bend the upper part of their body, which isn't really working their thigh muscles. So the correct technique, stick your bottom back, like so. Okay. Check my list. Lunges. So, one leg forward, the other leg back, and you just bend the front knee, coming down and back up, like so. And that's going to work your thigh muscles on the front leg quite hard. Other way around. So this is going to work my left leg, lunging down 90 degrees and back up. Step ups. Just pull that away from the wall. So leg up on the step, keep your knee over your toes, and you just step up and back down. Keep your weak leg on the step so that you're always working the weak leg. Up, just working on the way up as well as on the way down. You can also do side step ups, so the weak leg is on the upper side. Again, keep the knee over the toes, up and down, like so. Okay. And finally, for balance, it's good to balance on one leg. So you lift the good leg off the floor, balancing on one leg, and just trying to maintain your balance. Keep your eyes open initially. As you get better at this, you can close your eyes, which is more difficult. And then you can also try standing on an uneven surface like a trampette or a mattress. That's something that's a bit more wobbly, so it's going to work your muscles a bit more. So those are the kinds of exercises you could do prior to having knee replacement surgery, or if you have arthritis within the knee, to try and improve the strength, flexibility and balance of the knee joint. In my next video, I'm going to talk about the exercises you can do immediately after surgery. Thank you.